So in this fourth talk, I'd like to talk about prevention of hearing impairment and also hearing disability. So in this presentation, I'm first going to look at what I would call the chain of causation, that's of diseases, and then we'll relate that to the different types of prevention as defined by the World Health Organization. And then I'll look at particularly prevention of hearing impairment. How do you relate the types of prevention to hearing impairment? What are the interventions that you would use? And then I'll talk a bit about a new classification of disability, which has a bearing on prevention and how we address that and how we understand it. So, the chain of causation. Different people have different lifestyles and behaviors, but sometimes one's lifestyle or one's behavior can be a risk factor to your health. And if you continue adopting that lifestyle or that behavior, these risk factors may become so great that they cause a pathology, in other words, a disease in your body. And that disease will affect particular organs in your body. And here we're thinking about deafness, so we're thinking about the effect of the pathology on the ear. And then the effect that that pathology has on the ear, in terms of the person, how they function in their day-to-day life, that can be called a disability. And then how that person functions in society because of that impairment, in the past used to be called a handicap. And in fact, this classification was called the ICIDH, the International Classification of Impairments, Disabilities and Handicap. And that's by the WHO, World Health Organization, in 1980. It's still used to some extent, and I find it quite helpful in terms of prevention, although the word handicap has pretty much gone out of use now. Even in the word impairment is less use, although disability is obviously still used. But here I want to look at the different levels of prevention according to this scheme of the chain of causation. So you can have prevention at this very top level. We call it primordial prevention. If you can influence somebody's lifestyle and behavior and stop it becoming a risk factor, then that's a kind of prevention, or prevention of hearing impairment, say. And at the next level, if you stop the risk factor producing a pathology, or you stop that pathology actually causing an impairment in the ear, then that's primary prevention. Secondary prevention prevents an impairment becoming a disability, and then tertiary prevention prevents a disability becoming a handicap. Let's look at that, how that schema works in terms of hearing loss. So in terms of primordial prevention, these could be behavior changes. Say if young people were going to clubbing, listening to rock bands, exposing their ears to very loud sounds over long periods of time, that would be a risk factor for hearing loss. But if you can change somebody's behavior, use health education to encourage them to limit their exposure to loud sounds, maybe by using earplugs when they go to a concert, or reducing the number of hours that they expose to high levels of sound and that kind of thing, then that's a form of primordial prevention. Then at primary prevention, this is where you prevent the risk factor actually causing pathology, blocking or damaging the hearing pathway. And here you've got more specific programs such as hearing conservation for industry with loud noises, immunization programs for diseases which cause hearing loss such as measles or meningitis, Better maternal health, because poor maternal health can lead to hearing loss in the baby. Treatment of acute otitis media, and so on. And then secondary prevention is where you prevent the impairment becoming a disability. So in other words, although you may have hearing loss at the level of the organ, in terms of hearing at the level of the person, hearing disability at the level of the person, you can prevent that by secondary prevention, and that would be like early detection of a hearing impairment in a baby, and then you would carry out some kind of intervention to stop it becoming a disability. And then tertiary prevention is where you prevent the disability at the level of the person becoming a handicap. So if we just look at how we're going to use that schema, what conditions should we be targeting? I've showed this slide in a previous presentation, but we're focusing on the high frequency causes and those which can be prevented. Those were the green arrows. So in the very high frequency causes, chronic otitis media is the only one of the three that can be prevented. And moderate frequency causes, all of them can be prevented. Noise particularly, ototoxic drugs, these are drugs which damage the inner ear, such as certain antibiotics, and antenatal problems, and meningitis, infectious causes, foreign bodies, and so on. Let's have a look at these conditions in terms of their preventability. So I've listed in the first column these causes of hearing loss, and this is in the prenatal period before birth, and what can you do for primary prevention, secondary prevention, or tertiary prevention. So for example, rubella, this is German measles. This is a very severe cause of hearing impairment. If the mother has rubella during a part of the pregnancy, then the baby is at risk for hearing loss and also a various number of other conditions. But if you can immunize the mother against rubella before she becomes pregnant, then that will prevent her getting rubella and potentially causing hearing loss in the child. So that would be primary prevention in the prenatal period. And then you can look down on this slide, various other causes occur in the prenatal period. Let's just go on to the next slide. Similarly, this is the perinatal period. This is around the period of birth. What are the causes then? Well, a particular cause then is birth trauma. This is and hypoxia, low oxygen during birth. This is very common in developing countries because of the poor maternal health care that's available. But if you can improve the practices, the birth practices, and have midwives available who know how to delivery should occur correctly without lack of oxygen and in as quickly as appropriate, then that will act to prevent at the primary prevention of hearing loss in the child. Secondary prevention, this is where you carry out screening of everybody who might be at risk or high-risk groups. So in terms of the perinatal period, screening of the baby just after birth is a new initiative now. So most babies in the developed countries are being screened for hearing loss using a new technique called otoacoustic emissions, and gradually that is spreading to the low and middle income countries, but not got very far yet. So that's secondary prevention. And then tertiary prevention, that's preventing a disability becoming a handicap, that is providing hearing aids or possibly special education and other forms of rehabilitation. So in the childhood period, one of the commonest causes of hearing loss in childhood is chronic otitis media, that's chronic middle ear infection. And then the primary prevention, these are all the things you can do for primary prevention, so preventing chronic otitis media from occurring That's things like better personal hygiene, better living conditions, breastfeeding. Even the reduction of poverty has an effect on the incidence of chronic otitis media. Secondary prevention is similar to before. Things like health education for early recognition or screening, prompt treatment to prevent the disease becoming chronic, and then at the tertiary level you have provision of hearing aids or special education or rehabilitation, but also surgery may be able to prevent chronic otitis media at the tertiary level of prevention. And similar kind of schema in the adult era. So I won't go into that, but you can look through those slides to get an understanding of that. So that is dealing with the medical model of disease, where it's a personal problem. We use medical care and individual treatment, and then everything depends on the individual. But there's been a realization in terms of the understanding of disability that we shouldn't just use the individual medical model, but we should also use the social model of of health conditions, health problems. And this is where public health comes in as well. So instead of a condition being a personal problem, it can be regarded as a social problem. It's a problem of everybody. If somebody has hearing loss, it's not just that person's problem, but it's a problem for everybody around them and in the society. And instead of medical care, you might have social integration or social action. I said instead of. It shouldn't be instead of. It should be as well as. You should have individual care, but you also need social actions to deal with these problems. Other things like environmental manipulation. If you improve the acoustic environment, somebody with a hearing loss will hear better. Even people with normal hearing will hear better in that situation. So that has come about through a new classification from the World Health Organization called the International Classification of Functioning Disability in Health. And this relates to another initiative called Community-Based Rehabilitation, CBR. And this deals not only with health, but education, livelihood, social interactions, and empowerment. And this is all done at the community level. So that's another kind of revolution in healthcare that's going on now, particularly in low middle income countries and particularly involving public health methods. Just a brief word on this new classification, a little bit more about this, how it relates to impairment, disability and handicap. These are the old terms, impairment, disability and handicap. Instead of using those terms, the new classification uses function and structure instead of impairment. It uses activities instead of disability, and it uses participation instead of handicap. So it's taking a more positive view of the situation. Instead of the negative view of handicap, it says what is the positive in terms of participation. And in addition to that, it looks at environmental factors and personal factors. So it's a much more holistic view of the situation of somebody with a disability. So in terms of hearing, you've got, instead of impairment, you've got hearing. Instead of hearing disability, you've got listening. And instead of hearing handicap, you've got communication. And then you take account of the acoustic environment and the personal communication factors. So that's a very brief overview of this new classification. If you're interested in this further, you can go to the website of the WHO and search under ICF. And there's a whole setup there quite in detail about this, not just hearing loss, but all disabilities. And this also relates to another recent initiative in the UN, looking at the rights of people with disabilities. So instead of regarding people with disabilities as requiring charity, they're regarded as people with human rights, like everybody else. So this convention in the UN was about promoting, protecting and ensuring the full and equal enjoyment of all human rights and fundamental freedoms by all persons with disabilities, and to promote respect for their dignity. And there's various principles, non-discrimination, full participation, respect for human diversity, equality of opportunity, and so on, accessibility. So these are excellent principles, but it's the rights of people with disability that should be emphasized. And this has all sorts of implications. So there's a shift in thinking globally on disability from charity to rights, and there's various roles of governments, disabled persons organisation, people with disabilities themselves, and obligations on international organisations. So it's a sea change really in how you approach disability, what you understand by disability, and how people with disability exist and function within society. So the WHO produced a world report on disability following that, and emphasised that still people with disabilities are amongst the most marginalised groups in the world, and they have the poorest health outcomes, the highest rates of poverty. The numbers and the rates of disability are increasing, partly due to population ageing, but also to an increase in chronic health conditions. And often people with disability do not receive their adequate health care, are less likely to attend school, and more likely to be unemployed. So that was my last slide of the 4 sessions. Here is the girl Marina having her hearing tested. She actually was found to have chronic otitis media and a mild hearing loss, but she received treatment as part of the survey program and recovered, so she didn't get permanent hearing loss. Thanks for listening.